Hello, everyone. My name is Marissa Sherwood. I'm a third-year resident at the University of Toronto in the Radiation Oncology Department. I would like to thank the AACE Executive Council for supporting this project on family physician training needs in cancer patient care. I'm delighted on behalf of my co-authors to present the summary of our work. This project emerged based on recognizing the existing importance of cancer care, with the realization that this care is not provided by one group of practitioners, but a huge multidisciplinary team, where family physicians are main team members. This idea, combined with ongoing needs to improve oncology education across all training levels, led us to the concept of exploring training needs in family physicians and their own perceptions of their preparedness for cancer care. A qualitative approach was thought to be an appropriate avenue to elicit perceptions and narratives from family physicians. Data saturation was achieved after interviewing 13 family physicians in a semi-structured format and performed thematic analysis of their transcribed interviews was the way we analyzed the data. Our data was coded by one investigator, and main themes were generated after two separate reviews from two other investigators. The table you see here is just a brief summary of the demographics of our population. Through the thematic analysis, three main themes emerged. We labeled these as delineation of roles, oncology knowledge and education, and palliative care. Our participants described a lack of role clarity, specifically when a cancer diagnosis was achieved and treatment began. A key desire from family physicians was being able to navigate the cancer center and the care pathways for patients, and feeling unprepared for that role was a common trend, especially family physicians trained elsewhere before starting their careers in a different area. Another main concern was that any teaching for family physicians and trainees needs to be relevant to family medicine, and that input from family physicians or general practitioners in oncology is necessary for its design and presentation. Increased education in oncology in general, simply by more amount, was also desired, specifically with the topics of survivorship and side effect management being areas that were marked as needing improvement. Our final theme of palliative care was cited by many as the avenue to which, if they did receive oncology education, that was the rotation they received it in, and that past experience is how they became comfortable with cancer patient care. As well, palliative management of cancer patients was described as a time when family physicians felt they returned to being the main care providers for their cancer patients versus during treatment when they somewhat lost their patients in their care pathway. The results from our study will be used to advocate for changes in a twofold approach. At the practicing physician level, we will work with Ontario physician groups on a navigation package for family physicians to liaise with their closest oncology center. As well, the idea of an online portal or a defined information system for family physicians was brought up by multiple participants. This portal would help family physicians manage or track ongoing patient care, and our team will be looking into the feasibility of designing this and seeing if the right infrastructure is in place to do so. At the trainee level, these results will be used not only to advocate for increased representation of oncology and local medical school curricula, but to offer routes to do so, such as increased palliative care rotations or working with family physicians specifically when designing new curricular sessions. When I think about the impact that this grant has had on myself and my career, I can't begin to express my gratitude. This project would not have been possible without the support that this committee and this organization has given me. Personally, the support has not only enhanced several of my own research skills, but has led to recognition at my Center for Educational Excellence and has driven my motivation further to continue my research in the area of cancer education. So once again, I'd like to thank you for your support, and I wish you a successful general meeting.